Hello everyone, I'm Dr. Eric Ruhland from the St. Paul Pet Hospital. This morning I'd like to quickly address some questions that we've been getting and some phone calls we've been getting about the recent string of poison breads that have been happening in people's backyards and on the sidewalks in St. Paul. Let me just start out by telling everybody that this is a pretty rare incident when this does happen, and I don't want people to get extremely alarmed by this message. The purpose of this message for everyone is to give a little bit of education as to what has been happening and what, as a veterinarian and as a clinician, like how we either treat and how we address these problems. So a number of dogs were exposed or were given breads that had rat poison in them. One of the more common toxins that's in rat poison is brodivacum. And these rat poisons, and most of the rat poisons that are out there, are targeted at clotting cascades and clotting panels, and the inability for a patient to clot. That's actually how they work. So typically after a dog ingests rat poison, you have a day or 2 or 3 days. For the most part, you've got a couple days of a window before you're going to start to see any clinical signs or before the dog will actually start to bleed. Most veterinarians are very well trained at recognizing coagulopathies and clotting deficiencies in a patient. So to kind of give a little bit of insight on this, if you see your dog ingesting a foreign bread or food source or something on the sidewalk, I don't want people to be alarmed extremely. What you could do if you're very concerned, or if you see green pellets in that bread, or if you see your dog pooping any green feces or anything like that, that's a signal that a dog has been exposed to rat poison, and that dog needs to have treatment. So if there's a question, I think you should immediately just call your veterinarian and ask about this, or if your dog is eating something that looks like it was inappropriately placed in your yard or something that just doesn't look right. Call your veterinarian. What we usually do at the hospital here is we will test the dog to see if the dog has a normal clotting panel. If it does, the likelihood of toxicity exposure is very, very low. And we would usually typically not treat those patients. But there is a reversal and there is an antidote for this poisoning if that does happen. But again, the incidence of this happening, you guys, is extremely rare. We do not see very many cases of incidental poisonings, although a lot of people like to think that other people will maliciously hurt dogs. That just doesn't happen very often, thankfully. And it's just not something we have to deal with commonly. But I wanted to give everybody a little bit of information about what's happening. Again, this has been a very small subset of dogs, and I think some media sources have been sort of blowing this out of proportion. And I don't want people to be fearful. I want people to be educated about it. Obviously, call the hospital if you have any questions about this. You can talk to myself, Dr. Melinda, or Dr. Haley Inkpen about what we've been seeing. Again, we have not seen any confirmed cases here. One of our emergency clinics that we send patients to did see and confirm one case. But again, call us with any questions. Again, I'm Dr. Eric Ruhland from the St. Paul Pet Hospital. I hope to see you around the great city of St. Paul soon.